Hi, morning. As Summer said, I'm Vicki Farden, and I'm the supportive housing policy specialist at Minnesota Housing. So, next slide. So, for those who are new to supportive housing through Minnesota Housing, I'll just do a quick review of some of the basic expectations. So, supportive housing is affordable housing linked with social services tailored to the needs of the population being housed, with the goal to foster housing stability and improve quality of life for the population to be served. There's many types of supportive housing that serve various populations, but our funding is focused on serving people experiencing homelessness and persons with disabilities. We expect providers to follow housing first principles for low barrier housing access and retention, and to follow industry best practices like person-centered planning and trauma-informed care. You can learn more about some of these best practices in our supportive housing information and resource publication, which is linked on this page. And there's also additional information on our supportive housing webpage. So next slide. So supportive housing incentives. Minnesota Housing incentivizes the creation of supportive housing units by providing points to create units to serve high priority homeless households, which we call HPH. And HPH are households prioritized for supportive housing by the coordinated entry system. There's 3 scoring tiers based on the number of units, from a minimum of 4 units to 100% of the units. And these are shown on the self-scoring worksheet. We also provide points to create units to serve people with disabilities, which we call PWD units. These units are intended to serve extremely low-income people with disabilities who are likely receiving mainstream disability services through the county or tribal human services. And there's also 3 scoring tiers for PWD units based on the number of units, from a minimum of 4 units to 25% of the total units. And in addition, there is another scoring category to create units for people with disabilities that will use Section 811 project-based rental assistance. The scoring tiers are slightly different here, and you can see those on the self-scoring worksheet, and Ellie Miller will review those in a few minutes. Next slide. So for planning supportive housing units, it's important to consult with the local Continuum of Care Committee to plan for the high priority homeless units and units for people with disabilities to address the market need. They can provide information on the market for HPH units in the community where you're doing a development, such as the household and population types on their waiting list for supportive housing and the unit sizes they need. They can also advise you on appropriate service resources to fit the population being served. You'll also need to choose a qualified service provider and management agent with experience with supportive housing. And then you'll need to determine the funding resources for services and rental assistance, and also if you're doing a front desk, if you're doing 100% supportive housing. And if you plan to do units for people with disabilities, you'll also need to work with the tribe or county human services to identify the population type, the referral process, and the service resources. You'll also need to work with them if you'd like to apply for housing support to use for rent and possibly services for HPH and PWD units. And keep in mind that some counties do an annual RFP for their housing support program, so timing is important to contact when you contact the county. And then for 811 units, you'll need to work with the Department of Human Services contact person to discuss your project and when we get to the application requirements. So next slide. So for the application requirements for HPH units, all the required document submissions are listed on the application checklist in the portal. And then the specific requirements for HPH units are described on the self-scoring worksheet, and then also in some of the application materials. Some of the application materials include the supportive housing narrative, and you'll need to enter the HPH units on the workbook and also include the rental assistance source there. And then there's a continuum of care confirmation form, which, as I said earlier, please contact them early in the process to review your project. Then there's CLC points also for the household type that they've identified by the county location. And those are published with the RFP, so you can see if they need units for families or singles or youth. And then if you're planning to use housing support for rent, there is a housing support commitment form that the county or Tribal Human Services need to complete. And then there's the service provider qualification form that the service provider needs to complete. So next slide. And then for the PWD units, all the required submission, again, are listed in the application checklist in the portal, and the specific requirements are described on the self-scoring worksheet. So you'll need to work with the county to complete the persons with disability narrative, to determine the population type, referral process, and resources for services and rental assistance, and discuss the use of housing support. And again, complete the commitment form for housing support to submit with your application if using that source for the PWD units. And then also be sure to enter those on your workbook. Next. So some of the resources, work with your service provider to plan resources for rent and services for the supportive housing units. Some of the typical sources for rental assistance are housing support, which you request through the county human services, project-based Section 8 from the local public housing authority. And then if you can't secure rental assistance for the supportive housing units, the rents need to be set at supportive housing levels, which are described in our underwriting standards. Some of the typical sources for services for supportive housing units, most applicants use with a portion of supportive housing units in their application, pay for some of the services out of the development operating budget for tenant service coordination. And then housing support also has a service rate which requires long-term homelessness eligibility. So if you're planning to use that as a service resource, make sure there's an eligible market for long-term homeless households in that community. And it's not a recommended source for services for PWD units since it requires long-term homelessness. And then finally, there are Medicaid funded services. All service providers can enroll to provide housing stabilization services, which is a relatively new service from Medicaid. And if you're working with a mental health provider, there's several behavioral health service resources they can access. And then some providers can also provide waiver services. So next slide. So what is housing support? It is a state-funded income supplement that pays for room and board for low-income adults with disabilities and also for seniors. Housing support pays for rent, utilities, food, household supplies, and other necessities. It can be used for both single adults and families with an eligible adult. The housing support provider needs to contract with the county or tribe for a specified number of units. And the provider is generally the service provider associated with the project. The payments are made to the housing support provider to pay the rent and the other costs. And as I mentioned earlier, they can also receive the housing support rate when serving long-term homeless eligible individuals. The room and board rate as of July 1st of this year is $1,091 for community settings. And then our underwriting standards provide guidance for how to set rents when using housing support for supportive housing units. And next slide, please. And then just some quick notes for developments that are 100% supportive housing. All the units must have rental assistance or rent set at supportive housing levels. They must have a good plan to secure all the resources needed for services and front desk. And then for a competitive application, most projects include at least 50% of their units are high priority homeless units, as well as a number of PWD units that are also serving people experiencing homelessness. And as Summer said, the housing infrastructure bond funding is a great source for supportive housing. All those units must serve people experiencing homelessness. And then last slide. The last thing I want to point out is the tenant selection plan guidelines. These were revised in December 2020, so be sure to share them with your property manager so they're familiar with our requirements, especially the new tenant screening criteria for all housing units and in the additional criteria for supportive housing units. These guidelines are required for all consolidated RFP projects after March 2021. So now I'll pass it on to Ellie to talk about 811.
Hello, everyone. I'm the program manager for the Section 811 program. And as mentioned earlier, this rental assistance resource will be made available for the 2022 multifamily RFP. Section 811 is a program of the U.S. Department of Housing and Urban Development and designed to expand the supply and promote integration for people with significant and long-term disabilities. Minnesota Housing, in partnership with the Department of Human Services, was awarded a third round of Section 811 to produce approximately 160 new units. Next slide, please. Eligible applicants are private and public owners of multifamily properties that have been financed by Minnesota Housing or that have Minnesota Housing's housing tax credits, or owners that are in Minnesota Housing's project-based Section 8 portfolio with existing unsubsidized units. All eligible applicants must have experience administering HUD rental assistance. Next slide. The rental assistance resource will be made available in two ways. One is through the annual consolidated RFP, which we're talking about today. And it'll also be made available through an open application process for existing developments. Next slide. Lastly, this rental assistance targets people experiencing long-term homelessness and/or people exiting an institutional setting. All of the referrals for this program are managed by the Department of Human Services, assisting owners in receiving qualified applicants. For those of you that are considering developing units for people with disabilities, Section 811 is a great resource to be paired with the PWD units. If you want to learn more or better understand if Section 811 is a good fit for your project, there is a video link in the program introduction, which is included as a handout in this webinar. If you look on your control panel under the questions section, you'll find the handout there. I will now hand it back over to Sarah Bunn.